Hello, everyone, and welcome to this interview. I'm Sara. I work for the School of Global Health at the University of Copenhagen, and today I'm delighted to introduce the team behind BeLuna. BeLuna is a menstrual health startup founded by students that work to transform how we talk about, experience, and care for menstrual health through inclusive education, advocacy, and community engagement. Joining today's are Fernanda Soto, co-founder of BeLuna, nurse, menstrual health educator, research analyst, and graduate from the Global Health Masters at the University of Copenhagen. And also is joining us today Agata, co-founder as well of BeLuna, who brings a background in cognitive science, communication, and product management. Together, they are tackling one of the most overlooked issues in global health, which is menstrual health. Despite affecting billions of people through their lives, menstruation is still surrounded by stigma, misinformation, and silence. Today, we will hear how BeLuna came to life, how each team member contributes to its mission, and what they have learned from building a purpose-driven initiative. Welcome to both.
Hi, thank you so much for having us. We're so excited.
I would like to start with a question for Fernanda. What inspired you to focus on menstrual health, and why did you feel this issue needed more attention?
I think it was my own journey, my own health journey that inspired me. Um, when I was growing up, I didn't know anything about menstruation, anything about the cycles, and then I was diagnosed with now called PMOS, formerly called PCOS, after 1 year of starting menstruating. So then the journey of like, well, you have it, you don't have it, you have it, you don't have it. Then I became a nurse and learned a little bit about it, and I was like, oh, maybe I can look deeper into it. And then I did the menstrual health certification, and at first I got angry because I was like, why nobody taught me this? It could save me a lot of frustration and pain. And then I started talking to friends and family about this issue or about this topic, and they were like, oh my God, I didn't know anything about this. So I realized it wasn't just me, it was friends and family as well. And that's how I started to talk about it and how I became interested in just keep learning and sharing this knowledge that we already have.
Interesting. So, what was the problem that BeLuna was trying to solve from the very beginning, and what that emission evolved over time?
I think when we first started, we really wanted to put out a product to help people, which we are working on now, and soon hopefully will be on the market, which are the snacks that are related to 4 of the phases, and that was the goal. With the time we realized, okay, 4 snacks for 4 different phases is quite a lot when there is no awareness about the cycle. So we started to provide also the workshops and more educative content via our social media, because the product was one thing, but we really care also about community, because we feel like this is very important and we still don't talk about it and we don't have the support, while we all struggle with the same problems, basically. So it was very much community, workshops, and the product itself. So instead of focusing on one, now we are all over these platforms now.
Yeah, we are basically trying to build an ecosystem where we can support menstruating people from different angles because, as Agatha said, we realized it wasn't just a one problem slash solution when it comes to menstrual health. we have a big gap in different aspects of it. So that's why we are building an ecosystem where we can target some of them.
You both were students when you started, and I would like to ask you, how did your studies and experiences help shape the vision behind Luna?
I think for me, studying global health, coming from a global south country and studying in a global north, for me, I realized that the questions regarding menstrual health were the same. So even though we come from different backgrounds, different cultures, we're like the knowledge was nowhere to be found anywhere. Just science, and like even people with medical background is like, oh, we're not taught this at school. So for that, that's why I wanted to start BeLuna here as well, because it wasn't just one country problem, but also I realized that the experiences of menstruating, it's very different from individual to individual, from culture to culture, and that menstruating is shaped by your social cultural aspects and not just by your biology.
And regards my studies, I studied cognition and communication here. So it was very much focused on how we will communicate it, how we will make the message come to the people and make it also easy for somebody who has nothing to do with menstrual health, and they hear for the first time that they have different faces, and also be still engaging for a person who is already a little bit further in the journey and has a lot of knowledge.
In global health, we also study when health issues are communicated in specific way can really shape not only the behavior but also the perception of the health issue. How it works with menstruation.
We are aiming for it's to be very inclusive and very respectful. We are very careful to not overstep, I would say, on some people's beliefs and backgrounds. At the same time, we just really do our best to be very science-based, because there is a lot of also, I would say, fluff around menstrual health. It can go into directions of being very spiritual, which it's very good if this message is connecting with people. However, we are focusing more on the science-based approach to be able to get it across more internationally, not only to the group of people that identify with certain message.
I can add as well, basing or like doing it science-based as well also help us move the agenda or advance the agenda on menstrual health and moving it into a health agenda, not just something niche that, now that it's gaining momentum, but like to consider part of health initiative, not just something that temporarily will get traction, but something that it's affecting half of the population for 40 years, 24/7. So that's also why we are focusing on science or science-based education to keep advocating for research and promoting science or menstrual health as a vital sign.
I also think, if I can add, that the fact that we are coming from two different backgrounds, academically and also culturally, it's our strength, because we can discuss a lot. And it's not that we are always agreeing on things, but we have just different perspective. And this really, I think, was a plus in our case. And this is what we got from academia as well.
This is your strength. What do you think it can be or has been your biggest challenges when you were building BeLuna as a student entrepreneurs? What were the moments where you doubted or thought your project wouldn't succeed?
I would say that there's a lot of possibilities during being a student, and especially here in Denmark, the ecosystem is very helpful for you to build something. So I would definitely recommend to people to try it out. However, with the challenges for me, it was time. I was studying, working, and doing BeLuna. At some point, I was working in the hotel for the night, and during the day I was working in Novo Nordisk and then having my studies and then doing BeLuna, and we were doing events. So that was just a lot. And also during everybody's studies, our schedule is a little bit different because we have some time when we don't have the exams, then are the exams, so we were super packed. So sometimes it was hard to stay very I'm lacking the word now, but it was just challenging to have the same piece. And sometimes it was the moment when we had to let some things go or had a pause because it was just too much during the exams, for example.
Mhm.
Yeah, for me, I think it was also time. But as well, coming from a non-EU, it was challenging to navigate the visa and all of this paperwork process, because yeah, the ecosystem is really helpful, but again, they are not allowed to give you advice on this if they are not part from this institution that gives the visa and the work permits and all of this. So they only say, oh, you can read on the website or go to the call them. And it's very difficult. It takes you like 3 calls to figure it out if you can actually build a startup as a non-EU, and what are the limits and what are the things that you can do or the things that you have to do in order to build it as a startup and not just a school project.
Among all of these, did you find any support that was very valuable in your journey? Mentors, funding, university programs, partnerships, or something else?
We met at Lighthouse, which is part of the KU, and they are especially featured to support startups. So I think there was a lot of help from that, from the practical parts, but also just that you have a space that you can be in and you are surrounded by people that are like-minded and they are also having similar goal of innovation. So this is very motivating because yeah, there are a lot of doubts during this journey, and I think it's normal because it's something that it's a little bit outside most of the bubbles. So it was very nice to have these people that are also trying, and you see them and you see that they are continuing, so you are also a bit like, okay, let me keep on track as well.
Mm-hmm.
Yeah. I mean, of course, School of Global Health. um, they have been, or you have been, very supportive since the beginning. I think from our very first event, which was a success, and also trying like just again practical things of how to figure it out, funding and how to get the funding and like where to do it, or like just general advice also on, because being an entrepreneur also has its challenges, like personal challenges. So also being able to ask these kind of questions and have this trust that you have mentors, that you can just ask this. So I think mainly School of Global Health and Lighthouse
Yeah.
um, have been our biggest support now.
Well, I'm very glad to hear that School of Global Health has been part of this journey, because many students have ideas for change, but in the end they struggle to get started. So
Yeah,
we are here to support those that have the resources, but also the emotional capacity
yeah.
to lead these initiatives. What helped you to take the first step?
When we met, we both knew that we want to create something.
Mm.
And for me personally, it was definitely the Lighthouse that showed me that it is possible, and it's
Yeah.
very happy to just stay motivated with my idea, not only like, oh, maybe one day.
I mean, for me, I think it helped start not to see it as a big thing first, just to get started and then keep moving. And then, as you said, like seeing other people doing it and see all the resources that were given to us, I think it also helped me to start a little bit changing the mindset from the beginning, that it was like, oh, let's just gonna see where it goes. But after a while working with all of these people and mentors, I was like, well, let's make it work.
So, would you say that entrepreneurship has taught you something that you could have never learned in a classroom?
Mm.
I think so, personally. Definitely, it's what entrepreneurship taught me, that in class, maybe we can learn during the work groups, yes, but it was very much how different people work with each other. As I said, we have all different backgrounds. And at first, it was also challenging to navigate it, even though it is our strength, I believe. It's also challenging and not that easy. And in the classroom, you are often with the very like-minded people,
Mhm.
or at least you are focusing on the same problem from the beginning. Here from us was, I didn't have much knowledge about menstrual health. It's thanks to Fernanda that I am where I am with that. Um, and at first it was sometimes challenging. And I think now, after this experience, I think we both grow
Yeah.
thanks to that. The second part is also dealing with some contracts or projects that are just bigger than what we are sometimes doing in the classes. We held the panel discussion, which was our first panel discussions that we were organizing. And it was also challenging to navigate so many people, find the venue, create the content for it. And it's all the steps that actually, once you are out there and you're trying to do something, you're getting to know, oh, it's not as I thought it is.
Yeah, for me, it's learning to deal with all the challenges, because in class we learn, as global health students, we learn you never go to a community and just take over and stuff like that, and sometimes the problem you are trying to fix, it has other different reasons. It's not just whatever you believe. It's you can solve this and then everything will be solved. So for me, it was learning how to deal with these challenges when they come, because you will never know what the challenges are. And particularly this menstrual health, that it's kind of a stigmatized or taboo topic, and how would that look from our perspective, that we are trying to overcome that stigma, but we still live within this society where it's stigmatized. And again, learning that it's different experiences. You learn it in theory, but what does that mean in practicality, and like to actually build something around it? I think that is what I learned.
Also, I think it's, by now we are getting better and better in reacting very fast for changes, which at uni it's often that we have the agenda for the next half of the year. We know what we will be doing, we know when projects will be. And here we learn to change very quickly and to adapt very quickly to the situations, and also to let go after it's something was not perfect, to just think about it, analyze it, and let go and continue.
So, what's the hopes for BeLuna and its future?
Uh, I think our biggest hope now is that we managed to go out with the product, with our product that was the start of the BeLuna. And also we are having some meetings for future collaborations. So we hope to bring also more value to the society here in Copenhagen, and also maybe create something online for the broader audience that we have. And for our personal hope is that we could just engage to it even more now that our studies are done and we have a little bit more time on our plate.
Mhm.
Yeah, yeah, I think that would be amazing to work full time on it. And also, yes, to keep reducing the gap, the knowledge gap between menstrual health and users. So just to keep building our community and growing the community, where we create a safe space to talk about it, and keep learning how to do that.
Congrats, girls, for this very necessary initiative. I really wish you the best in your future endeavors. And before we finish, I would like to ask to each of you if you have any piece of advice for our students about creating social impact in a meaningful way. Yeah, if you would like to share something.
I think for me, it's work on something that really makes you passionate to work on it. For me, I think my friends know, like, I can bring mental health to every conversation that I have, even if it's drinks like coffee or something. So that it's what it has kept me going, that I'm very passionate about the topic. So just work on something that you really care about.
And I would add to it to have grace to yourself and be aware that if sometimes things don't go as you are expecting, to just keep trying and not being very pessimistic, because as we mentioned before, there are doubts that all of us have. But once you are just cohesive in your message, the doubts will be gone at some point.
Well, thank you so much for sharing your journey with us. BeLuna is a wonderful example of how students from different disciplines can come together to tackle complex global health challenges. On behalf of the School of Global Health, we want to thank you for your time and for the work you are doing to advance menstrual health awareness and education. And to everyone watching, we hope today's conversation encourages you to pursue the ideas and causes that matter most to you. Thank you so much for joining us. And
I also wanted to say that if anybody who is listening to us has any more questions, feel free to reach out to us on LinkedIn or on Instagram regards menstrual health, but also entrepreneurship. We are happy to discuss.
we will include all the details in the description of the video. And yeah, would you like to add something else, Fernanda?
No, just thank you so much for everything. And yeah, just keep talking about menstrual health everywhere, please.
Exactly. Stay curious, stay engaged, and keep working towards a healthier and more equitable world. In this case, towards a more aware world into menstrual health. Thank you, girls.
Thank you so much.
Thank you.